My name is Melissa, and I'm going to be assessing your nose, mouth, and throat today. I'm going to start by asking you some questions. Have you had any nasal discharge, any pain in your sinuses, nosebleeds, trauma, altered smell, cold or allergies?
No.
No? Good. Have you had, in your mouth, have you had any sores, a sore throat, bleeding gums, toothache, hoarseness, trouble swallowing, or any altered taste?
No.
Okay. Do you smoke or drink any alcohol?
I do not.
Good. As far as your dental hygiene goes, do you see a dentist regularly and have your teeth cleaned
Yes.
on a scheduled basis?
Mhm.
Good. So I'm going to start your assessment by examining your nose. Okay, and I'm looking here, and your nose is symmetrical. I'm looking at the shape and the color. That all looks good, and your size. Okay, and now I'm going to have you tilt your head back just a little bit. I'm going to look at your columella, yeah, and your nares, good and symmetrical. Okay. You haven't had any like discharge or anything like
No.
that, have you? Okay, good. All right. Now I'm going to be palpating your nose, so you're going to feel me touching your nose, okay?
Okay.
Now, if this becomes uncomfortable at any time, you let me know.
Okay.
Okay. Feels good. All right. Now, the next thing that I'm going to do is I'm going to be checking the patency of your nares. So I'm going to occlude one nair, and I want you to breathe in and out the other nair. Okay? I'm going to start right here. Okay. Now I'm going to be doing it to the other nair, okay? Okay, that was pretty good. Okay, then I'm going to be checking your nasal cavities now, okay? So I'm going to grab the speculum over here. Okay. And I want you to hold your head erect for this one. Get down here. Okay. Be inserting the nasal speculum. Okay. And I'm going to be looking at the nasal mucosa, the vestibule, and the inferior turbinate. Okay. Now I'm going to have you lean your head backward. Okay. And here I'm looking at the middle meatus and the middle turbinate. Now I'm going to have you lean your head back up a little bit, and I'm going to pull out just a little bit, and I'm looking at the septum. Okay. Now I'm going to be going to the other side and doing exactly the same. Okay, tilt your head back. Okay, I'm going to pull it midline. Put your meatus. Or look at your septum. Okay. All right. Now the next thing that I'm going to be doing, I'm going to put this up over here. And I'm going to be looking at your sinuses. Okay? So your frontal sinuses are right here and your maxillary right here. Don't see any swelling or anything. Now you're going to feel me palpate your sinuses, okay?
Okay.
Is there any tenderness there? Does that hurt?
No.
Okay, I'm going to be palpating here. Do you feel any tenderness? Does that hurt at all?
No.
Okay, good. So your sinuses, there was no tenderness or swelling there. Now I'm going to be looking at your mouth and throat, and so I'm going to put some gloves on.
Okay.
Okay. And I'm going to start by palpating your lips. So you're going to feel me touching your lips. Okay. That feels normal there. Okay, then I'm going to be looking at your buccal mucosa, your teeth, and your gums. So I'm going to grab a tongue blade and a light. Okay. And I'm going to have you start by clenching your teeth for me. Good clench. Good. That lines up well. The next thing I'm going to be doing is I'm going to be shining a light and using the tongue blade in your mouth to look at your buccal mucosa. Okay. You can keep your tongue in there, that's okay. Okay. Looking at your gums. Good. Okay. Now I'm going to be palpating your gums.
Okay.
So you're going to feel me touching your gums. Okay. I didn't feel anything abnormal there. Then I'm going to be using this tongue blade and I'm going to be touching your teeth with it, okay?
Okay.
Open up wide for me. There you go. Okay. Your teeth, good. Okay, so the next thing that I'm going to be doing is looking at at your tongue and the floor of your mouth. So I want you to stick your tongue out for me. There you go. It's in line and symmetrical. Looks good. Now what I want you to do is I want you to take your tongue and stick it on take the tip of your tongue. Yeah, just like that. Stick it on the top of your teeth. Good. Okay. Everything looked good there. Now I'm going to be looking at your tongue a little closer, and what I'm going to do is I'm going to be taking a gauze and sticking it on your tongue and turning your tongue from side to side and looking, okay? Okay, so you're going to feel me put this right over top of your tongue. Stick your tongue out for me. Okay, that looked fine. All right. Now I'm going to be palpating your tongue and the floor of your mouth. So what I want you to do is stick your tongue out for me. Okay, it looks good. Now can you take your tongue and do the same thing like you did earlier right on the roof of your mouth? Okay. Okay, that looks good. Okay. Now I'm going to be looking at your hard and soft palates and your uvula. So what I'm going to have you do is I'm going to have you tilt your head back and open wide for me. Okay. I'm looking at your hard palate and your soft palate. Take your tongue down just a little bit more. There we go. Thank you. Now I'm going to be getting that tongue blade, taking it and pressing your tongue down again. And when I do that, I want you to say "ah" for me, okay?
Okay.
I'm going to be looking at your soft palate and the symmetric, if your uvula is symmetrical, okay? Very good. Everything looked fine there. Okay, and the next thing that I'm going to be doing is looking at your oropharynx And so I'm going to be using this tongue blade again and looking at the back of your throat. Okay?
Okay.
Okay, I'm looking at your tonsillar pillars and your retropharyngeal wall. Okay, everything looked good there. All right. Now the last thing that I'm going to be doing is I'm going to be checking your gag reflex. Okay?
Okay.
Okay. So you're going to feel me touching. Okay. Very good. Well, ma'am, everything looked good today. So if anything arises, you come back and see us, okay?
Okay.